fellowship trained in 2 areas, corneal refractive surgery as well as anterior segment surgery. As Brett mentioned, I've been on the medical staff in charge since 2005. I'm already a friend of mine, patient. I really specialize in LASIK and lens implant surgery. I've been doing it since 1999. We've taken care of a lot of prominent athletes, as you can imagine, down in San Diego. Just recently started our affiliation with the San Diego State Athletic Program, so we're now taking care of the SDSU teams and players as well. Anyway, so you know, regardless of whether you're a Laker fan, an Angel fan, Trojan fan, which right now is unpopular, I went to the University of Michigan, so I'm a Wolverine guy. And Coach Fisher is here at San Diego State, so you know, me and him I'm seeing him actually next week. So I like the Aztecs now because I'm transplanted down here. But you know, regardless of what fan you are, the idea that I've noticed over the last 11 years in practice is get rid of the glasses. That's what everyone wants. They really, the skin, all the other parts of the body are great, but it really comes down to the eyes and getting rid of the glasses. I mean, I'm telling you, that's the focus. We've evolved the field tremendously. We started out doing RK, or radial keratotomy. We started then doing no flap LASIK, we went to flap LASIK, eye LASIK, and now we're starting to do implants as the baby boomers are starting to age. That's kind of the hot topic right now. Bottom line, the idea of surgery is we want to change the shape of the eye. So instead of your cornea, which is the front of the eye, we want to change the shape. That's how you get rid of your glasses. I had mine done 11 years ago. We started out doing RK, which is we make little incisions on the cornea, the front of the eye. It flattens the shape. That's what makes your vision better. It really comes down to surgeon. It's difficult to calibrate or get repetitive results. That's why we went to the laser. And with LASIK, or no flap LASIK, we basically just pulse the laser on the front of the eye. That's what changes the shape. With LASIK surgery, which has kind of been the big thing, we actually make a flap, do the treatment, and then put the flap back down again. It can correct pretty much anyone. It can correct nearsighted, farsighted, astigmatism. If you've had previous eye surgeries, whether it's RK, cataracts, we can pretty much operate on almost any patient. We used to use the blade. The blade is what makes the flap. We've actually changed that now so that we're pretty much using the laser on every single patient. I had blade LASIK done as a patient. I stopped using the blade probably 2.5 years ago, so I only use the laser on 100% of the patients. 100%. It's pretty incredible. The machine looks like this. This is the IFS laser. Our office has the newest one that just came out, actually just about a year ago. The only place that has it is the Navy base. The machine looks like this. You lay down on the bed. We have a little suction device. We hook up the cone to the machine, to the camera. So it looks like this once it's assembled. We have a little suction device that actually holds the eye. And the idea is to couple the cone to the eye using that suction device. This is kind of what it looks like. It looks weird, but it actually, believe it or not, does not hurt. You just keep the eye open, you turn on the suction. It's manual suction, there's no pumps, no machines. And we hook up the cone to the eye. Once we applanate or get a photograph, we actually turn on the laser, and it actually just makes air bubbles on your cornea. And you can make these air bubbles in any direction. You can make them horizontal, vertical, and that's what creates the flap. It's a virtual flap. It doesn't really exist. It's held by the air bubbles. And then as it's evolved, we can actually make any shape we want. We obviously use a semicircle, but we can make a square flap, we can make a triangle flap. I mean, it doesn't really matter. It's pretty cool if you really think about it. We can totally customize the flap. This is why you would never use the blade ever again. I mean, that's going back 10 years. So we make the flap. It's totally programmable any way you want. Once we have the flap made, then we turn on the laser to actually do the treatment to make the vision better. The laser that does the treatment is an excimer laser. It's what we call a full beam laser. You can put your hand in there, turn it on, it will not cause any burns on your skin. The laser is not in the visible spectrum. It's in the invisible spectrum. It's a very small wavelength light, ultraviolet. And so we have the laser that makes the flap, we have the laser that does the treatment, then the question becomes, how are you programming the laser to make the vision better? I'm sure you guys have all gone to the eye doctor's office, and that's the way we used to do it. We did it before Opera, and what's better, one or two. Now the machine is like the machine on the right, which is it's a computer that actually takes a picture of your eye and measures what your prescription is. You take that data, put it on a USB drive, and put that data into the laser. So it's totally computerized. And so basically with the flash drive, we put that into the laser, and now we have a complete all-laser LASIK procedure, which we call the eye LASIK. It's known in the marketing world as the eye LASIK procedure. It tracks. So if your eye moves during the surgery, it definitely tracks your movement of your eye. And not only that, in the last 2.5 years, it actually rotates. So if your eye rotates, cyclotorsion, then it can actually move with that laser, with the tracker moves that in a cyclotorsion fashion as well. Very precise. So this is the emerging technology. We started out with using a blade with a laser, and now that was our standard LASIK procedure. And you've got conventional LASIK. And some people still are doing that. However, now we're using computers that take your picture of your eye, map it out to a ruler, put that data into the laser, and then you get what we call customization. There's been 17 million procedures. There's a lot of procedures here today that are kind of new and pretty interesting. This procedure, they've done at least 17 million in the United States. I mean, it's proven by volume. They're taking care. When you have a celebrity do it, it helps drive the market. So a lot of the big name celebrities have it done. That's what makes you look young by not wearing the glasses. People who are over 21, in their 30s, 40s, it's proved the NASA astronauts are now having their LASIK done. Eye LASIK, the one I described. It's been approved by NASA. It's approved on the military bases, Navy, U.S., the Army. I mean, it's got complete approval. It's amazing. The treatment takes about a minute. Your vision starts out a little foggy, and within the next day you'll see. Most patients, when I do their surgery, they go back. If I do the surgery on a Friday afternoon, they're back to work Monday morning. If they're a surgeon, they're usually operating by Tuesday or Wednesday, but less than a week later. And the vision really dials up pretty fast. The big question is, how do you get rid of the reading glasses? I mean, that's the $1 million question. And those of you who are 40 or over, that's where it is. They've tried contact lenses, they've tried CK, LASIK lens implants. The industry right now is really related to lens implant surgery. So what we're doing now is we're taking out the cataract, which is this gray area up here, inside the eye. And then we put an implant inside the eye that actually can fix the vision. Of course, we scan the eye, get all our detailed measurements. And what's really interesting is the thing on the left is what my dad had done about 4 years ago. It's a hinge implant. It moves inside the eye depending on what you're looking at. So if you're looking at something close, it hinges forward. If you're looking at something far away, it hinges back. It's FDA approved, works amazingly well. The other implant that we like is a bifocal implant. See, it's on the upper right. It has a whole bunch of little circles. And depending on what you're looking at, you can see things at close or distance. This is not monovision. You can do both eyes together. I'm actually in the operating room tomorrow, and I'm putting in several of these. It's a hot product. It works amazingly well. What's coming out, it's not FDA approved, it'll be available in about 2 or 3 years, is this really cool product where we actually put a lens implant in the eye, and then we can laser the lens implant to make it come out perfect. And that's available like in Mexico, Canada, and Europe right now. And it'll be available in the United States. FDA trials just started last quarter of this year. We already know the product works. It's already got CE or EE, European equivalent approval in Europe last year. It's amazing. And this is what's going to really make this vision come out spectacular in the next couple of years. Of course, there's a risk of infection. You don't get the result that's advertised. You can get some dryness or starburst. But those patients will tell you that the trade-out is worth it. Even if they get some of these downside risks, they usually will tell you that they enjoy their vision to a certain effect. So it comes down to then like price. We tell patients, don't worry about the price. Come in for a free consult. We're just trying to find out if you're a candidate for surgery or not. That's the idea. If you're not a candidate, you don't want to go anywhere near this technology. If you are a candidate, then you can shop the doctor, you can shop the price, whatever you want to look at, that makes you feel comfortable. But you want to start out finding out first if you're a candidate or not. And I tell patients, try to make a connection with the surgeon rather than just get worked up by a bunch of technicians who are all very good. At the end of the day, it's the surgeon that has to make the decision whether to operate or not. And if the patient and the surgeon make that connection, they're comfortable with the interaction, that's the place you should proceed with. And that's why when you see these prices at $4.99, there's no way. They're not using, I mean, I know I run the business, you're not going to be able to do this high-end technology at a low-end price. It doesn't work out. You're going to get cornered out of something somewhere. I went through 56 slides. I went as fast as I could because I got 10 minutes. So I definitely will take questions. I'm over here for TLCB. And as you guys know, I'm on the staff from Chargers, so we're always looking forward to next week. We're the first home game on Monday night. First road game on Monday night. First home game in 10 days, 2 weeks. And we did Malcolm Floyd surgery 3 months ago, and I think this is